Now, antipsychotic effects. All the drugs will reduce hallucination and delusions, which is associated with schizophrenia, by blocking D2 receptors in the mesolimbic system of the brain. Now, the negative symptoms such as blunted effects, apathy, and impaired attention, as well as cognitive impairment, are not responsive to this therapy with first generation agents. But mostly second generation such as clozapine will also respond to these negative symptoms. Now, extrapyramidal effect. Dystonias, which is sustained contraction of muscles leading to twisting or distorted posture. Dystonia is basically distorted posture. Parkinson like symptoms. Akathisia, that is motor restlessness. Tardive dyskinesia, it is involuntary movement, usually of the tongue, lips, neck, trunk, and limbs. So these are the main terms for extrapyramidal effect: dystonia, distorted posture; akathisia, restlessness; tardive dyskinesia, involuntary movement. This is also somewhat related to this restlessness, but of tongue, lips, neck, trunk, and limbs. These are the effects which will occur acute or chronic treatment. Now, blockade of dopamine receptors is believed to cause these. Antiemetic effects. The antipsychotic drugs have antiemetic effect by blocking D2 receptor in the CTZ of the medulla. Now you can see here dimenhydrinate meclizine for nausea due to vertigo, but for nausea due to motion sickness, dimenhydrinate promethazine and scopolamine. For nausea due to chemotherapy, haloperidol, metoclopramide, ondansetron, and chlorpheniramine. Now, anticholinergic effects. Some process anticholinergic effect. It will include blurred vision, dry mouth, confusion, inhibition of GI and UTI muscle smooth muscle, leading to constipation and urinary retention. Now, therapeutic uses of antipsychotic drugs. First of all, treating schizophrenia, prevention of nausea, vomiting. Other uses are these are used as tranquilizers to manage agitated and disruptive behavior secondary to disorders. Chlorpromazine is used to treat intractable hiccups. Pimozide is primarily indicated for treatment of motor and phonic tics of Tourette disorder. Risperidone and haloperidol are commonly prescribed for this tic disorder. Risperidone and aripiprazole are approved for the management of disruptive behavior, irritability secondary to autism. Many antipsychotic agents are approved for quetiapine are indicated for the treatment of bipolar depression. Now, its pharmacokinetics, its absorption and metabolism. They are slow, variable absorption, which is unaffected by food. They will readily pass into the brain and have large volume of distribution. They are metabolized through different metabolite pathways, mainly due to cytochrome P450. Some metabolites are active and have been developed. Duration of 6 to 12 weeks and therapeutic duration of action of 2 to 4 weeks. Adverse effects. Now, urinary retention, weight gain, seizure, sedation, extrapyramidal symptoms, postural hypotension, sexual dysfunction, arrhythmia, and dry mouth. Now, extrapyramidal effect. The inhibitory effect of dopamine receptors are normally balanced by excitatory actions of cholinergic neurons. So, blocking this dopamine will alter this balance and cause a relative excess of cholinergic influence. This is resulting in extrapyramidal motor effects. The appearance of the movement disorders generally it is time and dose dependent, with dystonias occurring within few hours to days, following akathisias, which will occur within days to weeks. Parkinson-like symptom of bradykinesia, rigidity, tremor, they will occur within weeks to months. And tardive dyskinesia, it is irreversible, and will occur months or years after the treatment. Now, tardive dyskinesia is long-term treatment will cause this disorder. Patient will display involuntary movement including bilateral facial jaw movements, fly catching. Neuroleptic malignant syndrome. This potentially fatal reaction to antipsychotic drugs is characterized by muscle rigidity, fever, altered mental status, unstable BP, myoglobinemia. What are the cautious and contraindications? They all may lower seizure threshold. These agents carry warning of increased risk of mortality when used with elderly patients with dementia-related behavioral disorders, mood disorders. So now maintenance treatment. You have to remember this. Rates of relapse among patients with schizophrenia after maintenance therapy. Patients receiving atypical antipsychotic, that is risperidone, will show fewer relapses than those treated with haloperidol, a high potency antipsychotic. So it should have a maintenance period. Now this is an important summary table.